All right, so you're interested in getting a bigger butt or maybe a rounder butt, but you don't have enough fat and you don't want implants. Up until recently, I'd say, well, we don't really have a solution for you. But now, with a product called Is Alloclae, we absolutely do. So let's jump into it and talk about Alloclae. I'm Dr. Matthew J. Nykiel, board-certified plastic surgeon in Southern California, with offices in Newport Beach and Upland, California. Let's dive right into Alloclae. Alloclae is an extremely unique product that has just recently come out to the market. And what it is actually other people's fat cells. Typically, it comes from other people's tummy fat. What the company does is they bombard the fat cells with radiation to help kill off any other cells. And it leaves a structure that your own cells will ingrowth or incorporate into, creating more volume. This is a really unique time because we're now moving into the point where we can actually utilize science and technology to help us literally create things that we couldn't before. And that's the power of Alloclae. The other really cool parts of Alloclae is it's not surgery. It is a filler injected in your buttocks. Now, up until recently, fillers in your buttocks didn't work that well. They were extremely expensive. They didn't last that long. They either didn't work, and the one that did, which was mainly a silicone injection, frankly had really bad side effects from infections and inflammatory disease that it's illegal in the US and in most parts of the country. But that's all changed now that we have Alloclae. We typically start low and go slow with Alloclae, and we do that for a couple different reasons. Number one, the product is easier to manipulate and see the effects of as we add product in slower. Number two, it is a new product, so it is expensive. And because of that, we actually find that people do better by just starting with lower quantities and slowly adding to them. We'll typically add product on every 6 weeks to 3 months. How much product do you need? It's a really good question. For most people, we find that we like to use at least 25 cc's per side. So we break the buttocks into 4 main areas. Top of the butt, sides of the butt, or the hip dips, middle of the butt, or projection, and then finally, bottom of the butt. Now we don't typically inject a lot of fat into the bottom of the butt because it can square the buttocks out, so it's extremely rare that we do it, but it can happen from occasion. Top of the buttock creates that nice sort of shelf or differentiation from back to buttock, and we do fat injections there a lot. Again, we like to start 25 cc's per each of those areas. Hip dips, we like to start at 25 cc's. When we're actually trying to get projection, we place it into the central buttocks. Again, we start 25 cc's per side. Now we absolutely can add more, or if you're someone who just really wants volume to the top of the buttocks and say, listen, I'd rather just put 100 cc's per side to get a good shape change, we can. Now, one of the unique things about the Alloclae product itself is that because it is so concentrated, we find it acts about 4 times that of fat. And what do I mean by that? Well, we found that the volume change, or the push, because that product is firmer, is about 4 times that of fat. So the change that 25 cc's of Alloclae gives me would take about 100 cc's of fat. And you start to see the power that this product has. Alloclae is super unique and it's super cool, and it shows us the cutting edges of science and what we're able to do as we continue to understand the biochemistry and physiology of the human body. Want to learn more about Alloclae and see if it's the right choice for you for buttock sort of augmentation, roundness, or growth? Make a consultation. Still want to learn more about the product before you want to come in? Great, we got tons of educational videos below. Hit follow, like, or subscribe. Check it out. Until then, I'm Dr. Nykiel. See you later.